All right, we're going to continue health news this morning, and certain things are very hard to talk about when it comes to some symptoms, but they're important to tell your healthcare provider. We're talking about common symptoms that older adults often have to bring up to their healthcare providers, and because of embarrassment or feelings of stigma. Well, Dr. Arbaje is here to tell us how to work it all out. How are you?
Good morning. I'm fine. Thanks.
Thanks for coming in.
Thank you. It's a good topic today, so I'm excited to talk about it.
Why do you think so many people go through this?
Well, I think people think that these symptoms are just normal and that they're okay because they're just getting older, and they don't realize that they can actually be part of a problem that's been long-standing, and so they just are embarrassed to talk about it.
Well, let's go through them. Okay, so the first one is it's a tough one to talk about, urinary problems.
Right. So anything having to do with your bowels or your bladder, people feel embarrassed to talk about. But we're talking about urinary incontinence, which is problems holding your urine. So that can lead to accidents or leakage, people having to limit their social environment because they feel embarrassed about, maybe not smelling right or something like that. So it's really important to talk to your provider about it. And so one way to do that would be to think about the last time you had a problem holding your urine. It might be that you didn't make it to the bathroom in time, and then tell your doctor about that and describe kind of what happened around that issue.
Sort of along the same line with your bowels.
Bowels, yeah. It's, again, something that sounds a little bit embarrassing to talk about, but bowels are very important because it's one of the main ways we eliminate our toxins. And so constipation is a very important topic that older adults often don't bring up with their doctor because they just think it's part of normal aging. So it's important to bring up with your doctor how often you're going to the bathroom and whether or not you need to do anything special to move your bowels. Because if you don't talk about it, it might be that you can avoid a problem that is related to your medicines or your diet, and it's something that you can deal with.
So how would you say somebody approach something like that with you?
So obviously the best thing is if the doctor tries to ask you about it, but sometimes that doesn't always happen in the 15 minutes that you have with your physician. So I would say that they say, doctor, something isn't quite right, and it's been going on for a little while. I'm having some trouble moving my bowels, or I'm having some trouble getting to the bathroom in time. Can we talk about that? And that should be enough to prompt the primary care doctor to do something about that.
Another one that you said, definitely don't ignore sexual problems.
Right. And again, something we don't talk about as we get older because people just are assuming that older adults aren't sexually active, which is not true. So problems with low sexual desire, erectile dysfunction, or pain during intercourse, those are problems that are very important for older people, in particular because it affects quality of life and because many medications can cause these problems as well as other diseases that older adults have. So one thing that I recommend is if the older person is coming to their doctor with a partner or someone there and they don't feel comfortable bringing it up, just ask to speak to the provider in private and specifically mention whether or not the problem is low desire or problems with sexual relations or both, and then the doctor can help discuss those issues.
Okay, and last one, memory loss. Which is probably one thing that people always write off as I'm aging.
Right, exactly. Memory and mood as well. Especially during the winter months, people are having trouble concentrating. Maybe their mood isn't quite right. Maybe they're trying to remember the right word that they want to say and they're having problems naming something. It's very important to bring up. Again, and it could just be a little bit related to age, but again, it could be related to depression, dementia. It could be related to having a stroke or a heart attack, or the loss of a loved one can also cause memory problems with grieving. So one thing that I recommend is that you go to your doctor and say that you're having some problems thinking or that you're not acting quite right, and you don't feel like yourself. And then the doctor can perform a very simple memory test right there in the office.
Great. Well, and I always say doctors have seen it all, so don't be embarrassed, right?
Don't be embarrassed. You're there, and that's our job to be able to talk to these issues. So it's very important to go ahead and feel comfortable.
Okay. Dr. Arbaje with Johns Hopkins, thank you so much for coming in. It's always great to see you.
Nice to see you.